Florida's COVID cases and hospitalizations are plummeting tonight. Public health experts are cautiously optimistic that this could mean the end of our punishing summer surge. But Palm Beach County's top doctor is warning of more waves to come. CBS 12's Jay O'Brien investigates if the worst is behind us. Jay?
Yeah, Liz, that is exactly what one infectious disease specialist told me earlier today. She said she is betting the worst section of this Delta variant is in Florida's rear view. But amongst all of that, there are still lingering questions of why COVID is receding right now.
Appointments for monoclonal antibodies are pretty open tomorrow at this COVID treatment clinic in West Palm Beach. There were a few takers today, like Michael, who drove up from Boca after testing positive.
I don't know when it will end. I would hope that the numbers keep looking like this.
Florida's COVID numbers are down, both cases and hospitalizations.
We have people come and go.
A sigh of relief for doctors like Leslie Diaz on the pandemic's front lines. She's betting the worst is over.
I really don't think we're ever going to see an uglier face than what we just saw in the last 3 months.
I am concerned.
But Palm Beach County's top doctor, Alina Alonso, is warning holiday travel in the next few months might lead to more surges.
If you're vaccinated.
In the Sunshine State, though, Governor DeSantis is adamant a COVID wave is breaking, saying the state goes through viral surges in the summertime that begin to die down by fall.
We have a summer season here, just like last year.
His office points to the perilous picture for northern states already seeing climbing cases as proof COVID comes and goes with the seasons. But Jason Salemi, an epidemiologist at USF, believes it isn't that simple.
I think coronaviruses in general do have a seasonality. There's no doubt about that. But it begs the question, was this inevitable?
Salemi argues the bottleneck in hospitals and high deaths a few months ago wasn't a foregone conclusion, saying it could have been avoided by more vaccinations and better focus on efforts to stop the spread.
I do not think we needed to see record numbers of hospitalizations, record numbers of deaths during this wave.
Both Salemi and Dr. Diaz told me today that they see two reasons for the main purpose of COVID declining right now. One is an increased number of vaccinations. The other is existing immunity from people who've recently been infected by COVID and who are now flush with antibodies.
Last month, the president ordered companies with more than 100 employees to either mandate the vaccine or offer regular testing. Since then, there have been a lot of questions, but not so many answers. Now, lawmakers have quietly added in a portion of the Build Back Better Act that would fine businesses close to $250,000 if they don't comply. CBS 12's Andrew Lofholm now with when exactly this could happen and how it will be enforced. Andrew?
Speaker Nancy Pelosi wanted the House to vote on the Build Back Better Act this week, but that looks like it's unlikely. After first promising no vaccine mandates, in response to the raging Delta variant, President Joe Biden reversed course, saying private businesses larger than 100 employees will have to have their workforce jabbed or offer regular testing. He instructed OSHA to be its enforcement arm, and businesses that don't comply could be fined $14,000. Scott Hecker is former Department of Labor and current Washington, D.C.-based labor and employment lawyer for Seyfarth Shaw.
My initial take was, wow, that's unprecedented. OSHA has never really mandated or attempted to mandate in this kind of fashion.
One of the questions, how will it be enforced?
So OSHA is under-resourced, like a lot of government enforcement agencies. How many people do you need to audit vaccinations for, I think they put the number 80 million employees? How are they going to do that?
Hecker pointed to a tweet from former administrator for OSHA under President Obama, Dr. David Michaels, that said one OSHA press release is worth 210 OSHA investigations. In short, it will be a PR battle. And if the House Democrats get their way, fines for violations could skyrocket even more, with fines running as high as $700,000 for companies with repeat violations, something that could bankrupt some.
Folks are going to need to budget in a different way if that really gets passed.
There are also questions of the finer details, like who pays for testing and what would actually be fine-worthy.
We also don't know what the unit of violation is necessarily. Is that per employee? Is that per location? Is that per, your implementation of the plan?
And then there are the legal challenges. Already, Florida Attorney General Ashley Moody joined 23 other state attorneys general threatening litigation, which President Biden has welcomed. This is not something that many companies are comfortable going on the record with quite yet. I reached out to several across Florida to see what their plans were. The only one that actually got back to me was Publix, and they said simply that they want to wait for guidance from Washington.
All right, 5:35 right now. Besides COVID, there's another illness you need to have on your radar right now, the flu.
Yeah, and with hospitals already feeling the strain, doctors warn it's more important than ever to get your flu vaccine.
All right, let's go to our Kara Duffy now, reporting live near a pharmacy in West Palm Beach. So what's the outlook here, Kara? How bad could this flu season be?
Well, Matt, Ashley, keep in mind this time last year, most kids were still learning from home. Mask mandates were in place, and people were on high alert when it came to things like social distancing and hand washing. Now, as we know, kids back in the classroom, less people working from home, and all around, we're seeing loosened COVID restrictions. And that's got some doctors worried that it could lead to a more serious flu season coming up here. Now, we checked in with Dr. Leslie Diaz. She's an infectious disease specialist here in South Florida. She says, just to get an idea, last year she only saw about 2 flu patients who needed to go to the hospital. Years before, we're talking pre-COVID, she had admitted dozens of patients to the hospital each flu season. She now worries if people become too complacent and don't get the flu shot, well, it could put an even greater strain on ICUs that are already struggling to provide care.
And they would be very taxing on the hospitals as far as the need to keep up with the numbers and so forth. So I can see that being very taxing on us, similar to what we just went through for the last 3 months, which was horrific. I would never want to wish that on anybody.
So what if you just got the COVID vaccine, or perhaps you're eligible to get a booster shot now? Will getting a flu vaccine impact that? Dr. Diaz says there's no research that shows that it would be harmful to get both vaccines at the same time, but she does suggest waiting a few weeks in between, just because you may experience side effects with both, and it could feel worse if you get them at the same time as opposed to spacing it out a bit. And Matt, Ashley, the CDC has been telling us for weeks now they recommend getting that flu shot by the end of October. As we know, it takes about 2 weeks for the antibodies to fully develop, giving you the best protection.